Welcome. This is Bridges. I'm Muchi Bakochola.
Prison quality human
as we build a sustainable environment for growth. Welcome. This is very special. Today we're talking about that disease, that state of illness that oftentimes we take with levity, malaria. Recently, we were invited to a meeting of Africans who converged in Nigeria, in Abuja to be precise, to find a lasting solution to eliminating malaria. Because according to experts, it is one disease that can be prevented, one that can be eliminated. Some countries have done it, and everybody is looking forward to Nigeria to be able to eradicate. According to reports from the meeting, which we also were part of, some countries have succeeded in eradicating malaria. So what are the gaps? What are the challenges? And going forward, what solutions were preferred at this special meeting, which is called the Big Push Meeting to eradicate malaria in our society? Well, I'm sure that if you've never been hit by malaria, you know several other people that have been hit with malaria. In fact, I'm just recovering from one, but don't tell anybody. Let's get it on Bridges today as we look through the lenses of Bridges on how best we can, as a people, bridge the gap to eradicate malaria, and also bring in other stakeholders together to ensure that malaria truly is eradicated. Going forward, we have here with us, very importantly, our own son of the soil, like they say. He's the Chief Executive Officer of Rollback Malaria Coalition. And he lives in Geneva, but he was here too, and just decided, okay, let's build a bridge of sustainability that will, lead us to the pathway of eradicated malaria in Nigeria and indeed Africa. So I bring to you Dr. Micheal Adekunle Charles. You're welcome.
Thank you so much for having me on your show, and really looking forward to the conversation and the discussion. It's really about bridges, because we really need to build the bridges of society, and I think tackling malaria is one way to do that.
Yes, I like that. Tackling malaria is one way to do that. Quickly, I'll just say why this meeting was called together. Can you just give us, let's start building the bridge from that foundation. Why was it important now to bring everybody together to discuss malaria?
Before I go into the importance of bringing everybody together, maybe I'll just take a step back in terms of some of the statistics that we're seeing. So globally, we're seeing over 263 million cases of malaria annually, and we have over 600,000 deaths. Now, if we break down the 600,000 is not just a number, it's about people. And if I try to just give the viewers a perception in terms of what 600,000 means. 600,000, if you divide it by 365 days, it's about 1,600 people dying of malaria every year. If we break that down more, it's about 6 plane crashes every single day. We know that if there's one plane crash around the world, the whole world, is at attention. We lose 6 planes filled with mainly African children below the age of 5. Every single day. And that's where saying enough is enough. We need to come together.
Yes, enough is enough. And that was what actually transcended during the conversation with participants at that meeting. But so going through the importance of the big push, I'll come back to you quickly, Dr. Charles. What exactly should be done that has never been done before? What is new that is coming to the table that you want to share with our viewers?
I think there are a couple of things that are new. January 2025 happened to all of us when our international funders really restricted or cut back on aid. And I think for a long time we haven't owned the fight against malaria because we've always gotten external aid to come and support and all that. Now we're saying this is an African problem. We need an African solution. So I think the mindset is changing to say, how do we own it and how do we push this collectively? So that's changing, and we saw it from the voice of the Minister of Health, Professor Pate, who was very, articulate about it to say we need to own the problem. Owning it, then you can now, find solutions. The second thing is we also brought stakeholders from around the continent. Those that have been able to eliminate malaria, like Cape Verde, others that are struggling alongside us. We brought Uganda, we brought Cameroon, we brought Burkina Faso, just to think through what we can do together. There are a few things that we can do together. First and foremost, we shouldn't see the malaria problem as a health problem alone. Malaria is very multifaceted. I'm a medical doctor. I've worked in this country for many years. And I'm sure you also know, and our viewers know, if a child is sick of malaria, who goes to the hospital with them? It's the mother. The mother that has to go and sell, the mother that has to go to work, the mother that has to take care of the house, the mother that has to take care of the siblings. It's the mother that goes. All these other things suffer. So that's why I'm saying we need to look at it not from a health perspective, but from a whole of society perspective. If we look at what is the breeding site for mosquitoes, it's gutters, it's the potholes. We need to fix that. It's not the Ministry of Health that will fix the gutters.
No.
It's not them that will fix the potholes. It's infrastructure. We need to look at our housing. We need to look at education. We need to look at issues around gender, around development. And that is what has changed. We need to look at malaria elimination from a whole of society approach. And I'll just quote one thing that our colleagues from Cape Verde said. We were asking them what was the success for them. Apart from all the things I've stated, they said we had national will. Not political will. When we talk about political will, we're talking about our politicians. No. We're saying national will, which means me, you, the teacher, the policeman, the child in school, the university goer, the businessman, everybody. We need national will to be able to kick this out.
Reigniting malaria elimination in any society or in any community says every hand must be on deck. And it's not just about getting medication when you get sick. It's about preventing from getting it at all. And those are the lines which Dr. Charles has said to us. And the environment, education, because it eats into your pocket. These days people call, constantly, I'm sure you do receive such calls. People can't even treat malaria. So what should we be doing? And most of the medications anyway are not manufactured in country. Is that part of the bigger picture to ensure that at least when you get hit by it, it's affordable to treat?
Correct. And that is what this current government under the Minister of Health, Professor Pate, that is what he's really driving at. He's basically telling us that, the commodities that we get from malaria, whether it's bed net, whether it's treatment, whether it's rapid diagnostic test, all these commodities are coming from outside the country. And part of the awareness, part of the big push is enough is enough. We need to take this in our own hands. And part of taking it in our own hands is manufacturing these things. So by next month, there's going to be a groundbreaking around a company that will start manufacturing bed nets. We have many other companies that have started manufacturing the rapid diagnostic test. But what we are saying as Nigerians is it's not just for our own markets. How do we create that market for the whole of West Africa, for the whole of Africa? In doing that, we're able to also create employment for our people. Creating employment will mean people have more resources to be able to take care of themselves and of their family. So it's a win-win situation. We need to bring it back home. We need to own it.
Yes, especially creating the healthy herd of Nigerians who would work in all these places.
Correct.
And are not their ability or their capability to contribute to national development will not be stalled by malaria. So we're talking about investing in lives. We're talking about in-country funding. As the Chief Executive Officer of Rollback Malaria globally, do you think, what exactly should government be doing in creating an enabling environment that can help promote and fast track some of those things that you've just spoken about?
Yeah. I mean, it's a good question. What can governments do? I will turn it around to say governments cannot do it all. Governments can create the enabling environment, and that's what they're exactly doing with attracting companies to come in and set companies here, to get tax breaks, to get incentives, to ensure that, these commodities are produced here. So government is really doing that. The other thing from the meeting that came out clearly is that we've engaged the legislators, the parliament. They were there, and they were quite shocked by the figures we're saying. They were quite shocked by the statistics that we were given. And I'll give you just one little statistic. In Africa, if we're able to reduce the burden of malaria by 90% by the year 2030, which is in 5 years' time, we will be able to increase the GDP of the African continent by 127 billion US dollars. That's 127 billion that can go into education, infrastructure, into health, into whatever it is. So we're saying the fight against malaria is everybody's fight, and it's not money going down the drain. It's an investment for our future, investment for our children's future, and for our children's children's future. We have to do it. We have no choice.
We have to do it. We have no choice. Okay. You sit there, and with the paucity of funds now that are not coming from donors, what would you be saying to government in terms of budgeting? And we've said, we agree that there must be a conducive environment for these companies who want to come to thrive. But in terms of, a lot of things will still be government owned. Budgeting, for example, what sense do you have? Because you're a Nigerian after all.
Correct. I'm a Nigerian, and I know that it's not easy. There are many priorities. So we're not just looking at malaria, we're looking at education and so many things. There are many priorities. But what we've been able to set up is that how can government bring the private sector closer? So really, we've been able to set up what we call the End Malaria Council, which is really headed by government, but bringing private sector closer. So we have your likes of Aliko Dangote that is chairing it. So trying to ensure that, we can benefit from the private sector corporate social responsibility. They can bring some of their expertise in. It's not all about funding either. There was a study that was carried out by the World Bank to say that with the existing funds that we have, if we're able to increase accountability, if we're able to use the money better and wiser, not duplicate, integrate, we will be able to, with the money we have at the moment, we'll be able to do 30 to 40% more. So that's what we're saying to government, to say, how do you help us create that accountability? How do you help us ensure that there's that leadership so that implementation can go the step further to really reach the last mile and the people that need our services the most?
How close are we to a free malaria world?
In Nigeria, we have good examples. Today, yesterday, Lagos had reached a phase where, we're talking about pre-elimination, which is really significant. If we're looking at, the definitions by WHO, pre-elimination basically means there's hardly any more malaria in that state. Many people will say, how is that possible? This is Lagos, 20 million, inhabitants. But the government has been quite decisive. in the fight against malaria, because they understand and know the value of, really having a healthy workforce. So what they've done is they've really ensured that before any fever is classified as malaria, we need to test. And testing is key, because not all fevers are malaria. And that is why we are getting resistance. That is why people are not getting healthy, because we've just abused, the ability just to have fever, just take malaria drugs. Lagos State has ensured that anybody that has fever is tested. If it's not malaria, investigate further to see what it is. If it is malaria, then test and then treat it. So that is how they've been able to reduce the burden. And we're urging others to come on board to say, let's really put the systems in place to be able to ensure that this testing, treating is taking place. So are we close to elimination? I think we have a few good examples, but we are by no means, near the end line. There's still a lot of work that needs to be done by all of us, not just the government, not just the Ministry of Health, by all of us.
Yes, actually, I was going to say, please, let's build a solid bridge concerning wrong diagnosis, because that's what you get these days. And people say, oh, I've been treating malaria for forever, and it's resistant. I just would like to say to you, say to my viewers that not to re-echo the not every fever is malaria. You have the floor.
Definitely we have to continue to re-echo it, because if I say it in Yoruba, Iba is not malaria, Iba is fever. But when we say we have Iba and we go to the hospital, it's people automatically think it's malaria. It's not. So let's start re-educating ourselves, and that's why I say education is important. Re-educating ourselves, that's number one. If somebody has truly fever and malaria and they've tested, the second thing about education is that, you take the course of drugs for, 2 days, 3 days. After the first day, most people feel better, and then they stop taking the treatment. This is what causes resistance. We need to finish the complete course. That's education. We need to educate our chemists, our pharmacists, our community generally, to say, if you are truly diagnosed of malaria, please finish it and finish the course. This is not government. This is individual
responsibility.
And that is where the bridge comes in. It's the bridge between the government policies to the state level, actions, to the communities, to the individual. There needs to be a clear bridge between all those different factors to ensure that indeed we are able to stop this surge or scourge of malaria.
Well, another thing that I would want you to speak to, it's are we still getting any kind of assistance from development partners, from donors? How significant is that in our drive or in the plan to get to eliminate malaria?
We are still getting support, and we thank them for the support, because from one day to the other we cannot just leave and say, go away, we don't need your money. We still need it. So we thank all our developmental partners for coming in and supporting us. But what we are saying as Africans is to say, this is really an African problem. We need to have African solutions, and we need to ensure that we are also accountable, generating our own funding that should go into the fight against malaria.
Because the concern is, Dr. Charles is in Geneva, helping us to fight for something that is very endemic in Africa. So where's this bridge?
My body is in Geneva, my spirit is in Africa, in Nigeria particularly. So the bridge basically, as you know, is, being on this platform, speaking to our people, being in international fora, speaking to the Westerners as well. That's the bridge. We cannot do it alone. Each facet of society needs to come on board. Each continent, government needs to come on board. And that's why when you told me to come on this program, I loved the word bridges, because whatever we do, no man is an island, as they say. We need to continue to connect those bridges, build those bridges. And even once those bridges have been built, always look back and say, how can I continue to support? How can I make sure that everybody, is safe, basically?
Well, I have signals that our time, we're eating up on our time. But seriously, before you leave us, I would just want you to speak on the big push. How optimistic are you that it can work? Because everybody in that room kept saying, if Nigeria gets it, Africa has it.
As they say,
how challenging is that for you?
As I say, Nigeria is the big brother of Africa. Me being a Nigerian in the global space, I really want us to succeed in Nigeria, because it's right. If we succeed and we move the needle, others will follow automatically. We've seen it in other things. Nigeria is so powerful, so influential that it has to be done. How optimistic am I? I think if we commit and do what we say we will do, it will work. And again, I'll reiterate, we cannot eliminate malaria from a health perspective alone. We need all facets of society. We need that bridge to help us cross the water or cross the danger point. We can do it. We've seen it in Egypt. We've seen it in Cape Verde. We've seen it in India that has reduced significantly. We've seen it in China. So population is not an issue. We should use the population as our strength to be able to fight this deadly disease.
And diseases don't have borders.
They don't have borders. Indeed.
Right. So, well, there's also a gender face to malaria, like you said initially. The mother whose child is down with malaria, takes time off to go there herself. She's also vulnerable, particularly the pregnant women. I would need you in rounding up those who bring life on. What kind of protection do we need for them?
It's extremely important, and I have so many sad experience where I see a mother that has carried her pregnancy for 9 months. And then she goes to hospital to give birth. She dies because she's anemic because of malaria. The child is born with low birth weight and eventually dies. We have those stories everywhere. And that's why we're encouraging our men as well to join us in the fight. Men, please ensure that your wives go to antenatal clinic. When they get there, they will get what we call IPTP, intermittent preventive treatment for malaria in pregnancy.
That doesn't affect the
womb, doesn't affect the fetus, and it will just ensure that you have a good delivery, a bouncing baby, boy or girl, a healthy mother, and that's what we want. We want a healthy population. Men, women, grandmothers, grandfathers, please join us in this fight, because we cannot do it alone. We need everybody's support.
So before we let you go, and by the way, viewers, you'll notice that our set is different. We had to capture him where we found him, so to ensure that we don't lose that, so that we can share the experience that we were privileged to be part of at the meeting that happened recently. So before we let you go, share with us your last thought on the importance of the big push, why it's important that all of us together, everyone, has a role to play in eliminating malaria. And since you said it is possible, it's possible, right?
It's possible.
To eliminate malaria. Okay.
I will end with something that is close to my heart. I would say that we've inherited this disease from our forefathers, grandfathers, grandmothers, and beyond. It will be awful if we pass it on to our children and our, grandchildren, etc. We know the tools that work. We have the artificial intelligence. We know others can do it. There's no reason why we can't take all that, absorb it in, and then churn it back into something that works for us. I am hopeful. I'm a very optimistic person. And I think if we can all come together, we should go away from normalizing malaria to say, malaria, let's push you out. As I described when we were having the conference, malaria is a little mosquito, but it's like an elephant. It's an elephant that has caused mayhem on a society, on a country, on our continent. Enough is enough.
Right. We'll take it there. Enough is enough. One thing I can assure you is that Bridges will be tracking the development, and to be our joy to be able to celebrate very soon Nigeria free of malaria. They say it's doable. What are you going to do to ensure that malaria is eliminated from our society? It is actionable, it is doable. We ask everyone to come on board and do your part. Keep your environment clean. Ensure that your gutters are clean as well. Don't make your environment the breeding ground for mosquitoes. Like we would always say, no mosquitoes, no malaria. Thank you so much, Dr. Charles, for being on this program, and thank you, viewers, for watching. Sometime next week, we'll be back with more concerns, but let's share your views on these lines, and together we can build a sustainable bridge for the development of not just Nigeria, but of you. Thanks for watching.